Guys get bonus points for reducing your time of presentation, so win-win. Hopefully what you can see here, and we heard this morning in one of the groups I was in, around how do we encourage people to participate in our initiatives. Like Sarah said, there's a lot here that we already know, but now there is evidence to back what we know, and it brings weight to those conversations to actually invoke change of clinical practice. So that leads me on to the next piece, and this overall session is around turning evidence into action. In a minute, I'm going to introduce Nick and Jan, and realistically, neither of them need an introduction. But we're going to present something in a moment of action for you all in the room that helps us build this evidence profile for us to understand where our opportunity is and to give further great evidence that we can use to lobby and advocate change to happen in our community. So, further ado, I introduce Nick York, as you are all well aware, the chair of our CLL Advocate Network. And come on up, Nick. Nick himself is a CLL patient since 2009.
Good maths.
Yep. Yeah. And we also have Jan. Jan is the founder of CLL Ireland. We are honoured to have her working as a part of the CLL Advocates Network, but I will let you both talk to your presentation.
Thank you, Catherine. And thank you so much for that wonderful presentation. And there's nothing more exciting than an analyst with enthusiasm. And that was brilliant. I'm going to see if I can also win a prize with Jan for skimming through, because we've been up...
Don't look at that, because that says 15, but you've only got 10.
Well, we'll go for 8. Yeah, we'll go for 8. So I've already raised the question about this survey a couple of times. In 2021, at the beginning, it wasn't at the beginning, it was in the peak of the pandemic. It was still raging for us, but not necessarily for the rest of the population. It followed on, following on from the virtual CLL Horizons we had, which was the last time we came together. We had to act on certain aspects around COVID. And we also needed to get a true picture of what the health was of everybody's organisations in that current situation. And we also needed to use that to build evidence on our strategic priorities to deliver activities to meet your needs and the broader needs of our community. Was there a clicker somewhere? There we are. That's fine. Thanks, Jan. So, I'm not going to talk too much to this. I've spoken to everybody else. The whole purpose of CLL Horizons is to collectively gain your inputs, to focus on your priorities in your locations, and collectively for us to actually pull this all together for analysis together, to focus on particular research questions, if it's data collection, or prioritisation of resources, helping us restructuring the organisation, our activities, to make sure that's representative of everything. So we're pulling a few streams of information together, and we're building with repeating the broader survey across all service providers that we know or are engaged with that provide support around the globe. So you'll have received a soft launch of this in your email boxes. You all should who are here. I just want to speak to the value of everybody participating in these surveys. We invest a lot of time for you. You invest a lot of time for us. We end up all together investing a lot of time for our patients. And if everybody doesn't participate in these surveys, we do not get a true picture of what the needs are and what the situation is. And, we are tailoring and looking to the next steps of the surveys that were just discussed by Sarah and AJ. So I'm just flagging this here. We're going to follow up again with a little bit more information explaining how we're building on the last surveys. But I'll just trip through because I'm trying to catch up on time. How have our surveys been used since last year? We'll send a full report out so that you've got an impact report. But I can flag a few. You've already been in the workshops around the CLL clinical search. And I've got to thank Myrna and Johannes and the team for inputting on that. That's responding to 2 greatest unmet needs. And we've also shared the information about this with the clinical community. Clinical community are very supportive of this because it's aligning with an unmet need. It's been evidenced by the patient survey, and it was also evidenced by the last version of this survey that was the greatest unmet need and the greatest wanted service of provision. So we've acted on that. Since then, we've listened to advocate needs with regards to the creation of an advocacy toolkit. We've also used all of the information and the requirements for a resource hub. So there's a global searchable database resource hub, really navigable, created by Myrna and team, which is fantastic. Leading on to the inputs we had around about the same time with regards to immune challenges triggered by COVID. You know, we formed the International COVID Blood Cancer Coalition, where collectively the entire blood cancer community came together to address these challenges. We've written definitive papers that now, because COVID put a lens on the immune issues in CLL, that definitively define those immune challenges, supported by the patient writing group, supported by the clinical expert immunology group. We've moved that forward now to formation of a task force following workshops of global stakeholders in all different stakeholder groups: immunology, hematology, psychology, other MDT members, the global advocacy community in CLL, industry, and that's now moving forward to another initiative to finally approach these unmet needs. So we are acting on every bit of information you give us, but if the information is incomplete, we can't do it properly. So without further ado, so that just asks you what we're covering. We just want to understand your health, your services, your organisational information in terms of your offerings. In other words, your current services and resources, how you offer that. That also helps us with updating the resource centre. It also gives us a true picture of how service is provided and how it varies in different regions, areas, countries, localities. It helps us update our services and resources from your unmet need and focus that you put into that. And it also, we seek your perspectives on your patients' access to healthcare, and we will support that then with the direct patient experience survey. We're going to be refocusing a lot of our surveys in different flows with CLL focus over the next year to meet different initiatives. But it's always interesting to hear what you perceive or what you say is the unmet need of patients and what patients do as well. So that's useful information to help sort of measure and give you feedback to help you focus your initiatives. And the other thing is the landscape's changing. It's an evolving condition. Technology's changing. The pandemic has had a major impact on service delivery and the way we deliver service. So we also need to get a gauge on that. And so please, take that extra bit of time. You've taken a considerable amount of time to invest in coming here. Take the time to do that, because I'm sure the outputs will be massively beneficial. And I've stolen all of your time, Jan. Sorry. Have I gone too fast? Next steps, I'm repeating myself, so I'm handing it over to you, Jan, as you've been one of our great organisers behind this and pulling all of the strands together with Sarah and team. I'd like to thank Sarah. I'd like to thank you, AJ, as well, for your extraordinary mind, and just hand it over to you for anything you want to say to the team.
Yeah, sure. So just to reiterate what Nick has already said, I mean, you guys are our community. We need you to engage with us. We need you to respond to the survey. So it was soft launched a couple of days ago. Some of you won't even know that it's in your inbox. Please go and check your inbox. Say that again. And your spam and your junk mail, in case it got lost somewhere. And also, just an important point is that just one person from every organisation should complete the survey. And we really need you to do this. This will enable us to form our future strategy, but also it allows you guys to have a voice and bring it to us and let us collaborate and help you guys. I think that's all. I have to say.
That is. I mean, listen, it's been a massively powerful experience, and tiring experience, complex experience, just to bring us all together. And I think we don't want to overload with you, we're just letting you know that it's in your email box, and please follow up. The whole exercise of all of this is we're bringing everything together just to make sure everything we suggest and analyse and feedback to you is evidence-based for the group decisions and feedback and invitations to get involved. So thank you all.